Amid the complicated developments of COVID-19 pandemic, Cần Thơ City has called upon the participation of the community in the fight against COVID-19 enemy. In response to the call, doctors, nurses who have retired in Cần Thơ City exactly engaged in the battle against the pandemic.
At the age of 60, retired nurse Huỳnh Thị Được continues taking part in the fight against the pandemic in her residence. With 30 years experience as a laboratory technician at the Military Hospital 121, Ms. Được volunteers to join the COVID-19 community group of Long Hoa World. Every day, she comes to households of the world to publicize about implementing the 5K rule, catching information on residents of people from other places, and instruct them to make medical declaration for timely quarantine.
Taking part in the local medical force brings me the feeling that I'm still healthy. I'm in charge of giving health consultation for local people, and I feel that I can still do a good job of a medical worker. Not until my health won't give me permissions does I quit this job.
Like nurse Huỳnh Thị Được, Huỳnh Thị Thu Hương also has 30-year experience as a nurse at the Internal Medicine Department of the 30 tháng 4 Hospital and then Cần Thơ City General Hospital. She retired at a time when the epidemic surged, so she volunteered to join the local pandemic prevention and control force.
I joined the local medical force with the thought that we will help fight back COVID-19 pandemic.
Like at the wards of Bình Thủy Upper District, there are 5 physicians in the world to take part in the COVID-19 pandemic prevention and control task after retiring from their work as physicians in the medical sector. At the age of around 60, the enthusiasm of white-blood soldiers are still there.
Experience of retired medical workers is the strength that helps them mobilize locals to effectively prevent the spread of the epidemic. From then, local people are highly aware of preventive measures to fight against the epidemic. The force of retired medical workers gives much contribution to local medical force in the pandemic prevention and control and public health as a whole. Particularly, they give effective assistance in tracing, zoning, and isolating infected cases.
From early morning to late afternoon every day, retired white-blood soldiers give assistance in SARS-CoV-2 virus tests for residents in lockdown areas, instruct people to make medical declaration on Zalo or to install QR codes, publicize the observance of 5K rule, and accompany public security force to go to each of houses and residents. Not benefiting any policies or subsidies, medical ethics of white-blood soldiers is above all in the epidemic prevention and control front, with the hope of exerting efforts to fight back the pandemic to bring life into normal.
Retired medical workers work very hard. They spare no efforts, go to each of houses to carefully instruct locals to observe epidemic control measures, from then contributing to helping the locality prevent the spread of the pandemic.
Services rendered by retired medical workers are such that will get stronger as age gets older. Their services actively contribute to the local task of epidemic prevention and control. Is the bright example for young generation to follow.